Broadcasting from the Business RadioX studios, here is your R3 Continuum Playbook. Brought to you by Workplace MVP sponsor R3 Continuum, a global leader in workplace behavioral health, crisis, and security solutions. Hi there, my name is Shay McNally, Digital Marketing Project Lead at R3 Continuum. On this episode of the R3 Continuum Playbook, we're going to hear a segment from a recent webinar that was done with R3 Continuum Chief of Staff and Chief Strategy Officer, Linda Saggau. This webinar was titled The Interplay of Stress and Burnout, What They Are, How They Relate, and How to Combat Them. It may not be widely understood the differences between stress and burnout, as they often go hand in hand, but they can have some significant differences. This webinar highlighted these differences and took a deeper look into the impact and effect that burnout could have on your employees and your organization as a whole. And kind of like on that of like doing, self-assessments or seeing it in other people, can you kind of go over what like the magnitude of all of burnout is in the workplace?
Yeah, for sure. We put together this little slide for you all. The sources are stated down below, but this is pretty recent. This is research over the last maybe couple of years. So now that we understand what burnout is, it's just important that you understand the magnitude. So 75% of workers have experienced this. My guess it's probably more. The pandemic didn't help, right? 40% specifically said they experienced it during the pandemic. So, you think about what our frontline healthcare workers have faced. Again, burnout is complete exhaustion due to repeated exposure to emotionally demanding situations. Think about what they've been going through. And if you are one of them, thank you for everything you do. Everything you're going through, everything you've experienced. If you are experiencing burnout, don't dismiss it. Take time to take care of yourself and put together a strategy to ensure that you can get out of it. 67% of workers said that increased over the pandemic. Gee, I can't imagine why. Fortunately, my son was launched off to college, but so many of my coworkers had, a new puppy, 2 children that they were homeschooling, cooking, and household chores increased. There weren't offices to have, two people or 2 partners, doing their conference calls. There were a lot of emotionally demanding situations over the pandemic. And they continue. We still have to be very, very cautious. And then managers and individual contributors, they saw the pressure increase as well and their burnout increase as well. So there was, a quarter of them pretty equally that reported burnout. And as we look at the convergence, right, of what's going on, the news is emotionally demanding. Give yourself permission to take a rest from it. It doesn't mean that we bare our heads to the needs of other people and the issues going on in the world, but give yourself permission to step away. Give yourself permission to step away from this thing and stop scrolling on Twitter or Instagram or LinkedIn or whatever it is. There's a moment where you got to put it down. Pay attention to your sleep hygiene. If you can, resist the urge to bring this thing into bed with you. It's one of the best things you can possibly do. So
I absolutely
go ahead. Sorry.
No, I was going to say, I absolutely agree with the news and the Twitter. I was going to bring up Twitter because sometimes even I'll read something on there and be like, nope, I can't go into this. I can't go down that rabbit hole type of thing and give myself a break. I think that's very relevant to me. So I thought that was funny you brought that up. Mm-hmm. So we see obviously the magnitude. 75% of workers have experienced burnout. Can you kind of talk to us a little bit about the impact that's truly having?
Yeah, well, we're seeing it in the Great Resignation, right? Not all of our companies, but we're seeing it in many organizations. So, almost 3 times, well, I round up easily, 2.6 times. If you're burned out, to seek a different job. And what these folks probably don't understand is that their burnout is going to go with them. Because the behaviors and the habits maybe not taking care of oneself or whatever are just going to go with them. So you might want to consider just, if there are good things about your job and you're being treated fairly and compensated fairly, you might want to stay there and just see like, okay, what happens if I deploy a self-care or a burnout strategy? 63% are more likely to take a sick day, and 23% are more likely to visit the emergency room. So workplace stress and burnout costs a lot, and globally it costs over $500 billion per year, and there's 550 million workdays lost. So it is not only a devastating thing for people, but it's a devastating thing for organizations and our communities and our economies. So, again, I kind of like to, when I talk about this topic, it's tempting to boil the ocean, right? But I want to just remind you that the change actually starts with you, taking care of yourself, noticing your own signs and symptoms, and kind of educating others when it's appropriate, and helping them understand what they can do to help themselves. And then, they get to share, and they get to share, because, waiting for, see change to happen is not going to get at this problem. We just have to look at this as individuals in our communities, our workplaces, our families, and have productive, healthy conversations about it.
Yeah, absolutely. And I think it's really interesting hearing that you're, the sharing pattern. It's that trickle effect. I'm not a clinician, but here I am listening to you, and now I'm understanding things, and I can go tell my buddy that's in healthcare, that I know is struggling, but he's just continuing to go. And now, you don't have to be a clinician. I know you mentioned armchair therapists and that, all that, but you can lead them to different resources that we've kind of discussed throughout this as well. So I appreciate that comment too.
Right. And that's, really the core of, things like mental health first aid. It's about sitting down with somebody and saying, hey, I care about you. And I've noticed that, it appears that you might not be doing well. How are you? And then the opportunity is just to gently, make suggestions to doors for help that people can walk through. And, it's how we serve others. But also, if I ever slid into burnout again and I needed to have an intervention, I would hope that my colleagues, shame, no pressure, would pull me aside and say, hey, I've noticed. And it's always done with the greatest care and compassion. It's not about judging somebody. And I've literally seen people do those gentle interventions at work with their families, and do them without judgment. And it's actually helped people get closer. It's not driven wedges. It actually helps people get closer because you're actually expressing care and concern, and you're leading people to resources that are viable. You don't want to send people to any resources that are not viable.
I'm sure most of us can relate to feeling stressed while working. In fact, it's very normal. Over time, however, if that stress is growing little by little, it can slowly lead to burnout. It's important to understand how burnout can impact your organization and what can happen if it's left unaddressed. R3 Continuum can help. Connect with us and learn about our services at www.r3c.com or email us directly at info@r3c.com.